We've got Davina and Lawrence versus Cameron and Izzy, and then you'll like give speeches like you would to finish the round, and then
Just about what?
we'll watch the front half of the round.
Oh, okay.
So you'll flow that, and
Got
then
it.
we'll redo speeches after we've finished the round. Comprende?
Is this taking the flow from yesterday?
What?
Never. I wasn't really. I didn't hear you. What would you say?
Don't worry about it.
Just kidding.
No,
Just kidding.
don't worry.
I don't want to do anything with my flows from yesterday because they're barren.
I found a slower round.
Oh, that's good.
What is this on the pharma topic?
Yeah, it's Honkster _lifts.
Oh my god. I love the I like the pharma topic.
Did you debate the pharma topic?
Yeah, I did. We got first place at North Catholic.
Oh.
First or second.
Oh, North Catholic. Oh.
Oh no, it was North Catholic. So
Look,
just
my
popped
dog
off.
is here. He's very cute.
Lawrence pops his little head up. Okay.
Lawrence flexing them AirPods.
He's almost worse than Subhash. Oh, that kid's a fiend. Okay, so what is Wang? Wang is how you win the round. It's not just saying a word. You actually have to like warrant out what your Wang is. What does warranting mean? Lawrence?
What?
Oh, for two today, Lawrence.
Sorry.
Okay, so warranting is explaining, right? So we can remember it with the simple word of stomp, right? So we got scope, which is the number of people being affected, right? Like if you're looking through a telescope, you can change the scope and see more things. Time frame, so these can be broken down into like prereqs or if it's long or short term. So like if you have something that's more important, like comes first, then obviously it's going to be more important. That's what time frame is.
Or you can say that like in the long term, this will like balance itself out, so it doesn't matter. Like you can say the long term is going to affect more people, so we should prioritize that over some short term.
This next one, it's kind of stupid. No one really uses it. It would just be like free speech is good, but no one would really use that because you can't really like quantify how good free speech is. Like protecting free speech is hard to quantify, right? Magnitude, it's just sheer amount. And you can also look at like the reversibility of the impact. Like, is this going to not be able to like turn around? Will it be like this for like all of time, or will it switch the next 2 years? Because if it switches like back, obviously it's not going to be that important because in the long run, like the status quo solves. Then there's also probability, which is just like how likely an impact is going to happen. So like Sina and I, last year, we read some card that said like the chance of war is going to increase by like 347%. So that seems like on face value, that's like really high with the probability, but the original value is like really low. So if you actually called that card and weighed against it, you'd know that like the probability doesn't matter in that scenario.
So when we did that, we were trying to outweigh on magnitude rather than probability. So we said our magnitude of this impact is war, which is really high. Even though the probability is low, the magnitude is so big that that doesn't matter. We want to mitigate any risk of increasing that. But another team might try and outweigh on their probability. They'd say, well, we're not impacting to war, but we're impacting to 100 people, but we're 100% definitely going to help those 100 people. And then the judge has to weigh those two. Or you want to do the weighing?
Yeah, you want to do the weighing. Another way people say probability is like strength of link. It's kind of the same thing, but it's like looking at like what we talked about your link chain yesterday and how likely that is to happen. So that's just another way people will say that. People will also say chance of solvency. So they'll like present a problem like climate change. And if you have like a risk of solvency, that means the probability is still low, but it's greater than 0, which is going to be net good. So then we also go into like more advanced like Wang, which would be moral obligations. So let's say like we have a moral obligation to oppose racism. So even if their impact is like climate change, we would say that like racism is going to prereq climate change because like in order to weigh any other ethical concern, you have to reject racism to make all morals like the same, if that makes sense. So if you remember yesterday, I showed you like a weighing overview about indigenous people. So that was a moral obligation to stop a cultural genocide.
How'd that work then?
We won that round.
The one round.
Yeah. And then meta weighing, if you see like meta in front of any word, it just means like a really big picture. So meta weighing is weighing. So like if I say, let's say the other team is saying magnitude is like really high for their case, and I'm using like a moral obligation about racism, right? So I'm going to meta weigh saying that weighing through magnitude is bad because it always prioritizes like helping the many and like hurting the few. And in my case, that's going to be minorities, which is Black people, right? So even every time you weigh through magnitude, it is going to hurt Black people in America. So that's like the weighing mechanism. Anyone have questions about weighing? Lawrence, you're looking a little confused.
Meta weighing, another word for it is like comparative weighing. Like you can say, you should usually, if you're going against a good team, both teams should be doing weighing, and you should give the judge a reason why they should prefer your weighing.
Wait, so meta weighing is like you're both weighing, and then you're like weighing their weighing against your weighing, and saying that your weighing is better than their weighing.
Yeah, so like a lot of the times, like if somebody just tries to at like the local tournament, somebody will just drop one of those words, like we outweigh on magnitude. And then you should say like you should prefer our weighing when we like explain it the whole way through. We give warranting and we quantify specifically like our probability of impacts, whereas they just kind of like name drop magnitude.
So like you would say like the probability is more important than the magnitude.
You have to explain why too.
Yeah.
But
like,
yeah, you would say.
If someone just flashes like one of those keywords in your final focus, you can literally just be up there and say, they said they outweighed on magnitude, but I don't even understand what that means. Like, because they don't explain it. The judge probably doesn't know what they're talking about if you don't know what you're talking.
I don't know if I'd say I don't understand.
Oh, I will. It works like a charm.
I don't know if I'd say I don't understand. I'd say they don't explain this.
Yeah.
But I understand anyways because I'm a genius. I mean that's what I would say.
Okay, thanks.
Okay.
Should I flow this? So are you guys flowing this and then they're gonna give summaries and final focuses?
Yeah. I'm going
Flow
to
this too. Give me 1 sec.
Can everyone see this? Because I don't really know what my screen's showing.
Yeah, I can see it.
Thanks. Okay, this was at Glenbrooks like 2 years ago. Both of these teams are really good. They've like both broke at the TOC, I think, this year. The second speaker in red here got like 3rd at this tournament for speaker awards. So they're pretty good. This was the second time they hit each other this tournament. So if they say stuff like, we've already had this debate, it's probably because they hit each other 4 rounds ago.
So are we supposed to be playing this?
Lawrence, you ready?
No, I'm still on my bed.
I believe the neg is speaking first.
My dog is sleeping, but his eye is open, and he looks like
That's
he's being
so
possessed. I know.
In 2nd grade, we were learning math, and there was this kid just lying on his desk with his eyes open, but he was sleeping. Oh my. It was
Like what?
the scariest thing.
Cameron Mackey Piccolo was always sleeping in our stats class.
Oh, look
Yeah.
at me so creepily.
Yeah,
Lawrence,
Cameron
are you
would do
wearing a
that.
gi?
What?
Is Lawrence wearing a gi?
A what?
Like a karate gi?
No, this is like some clothes my mom bought in China.
Oh, okay.
Like a bathrobe,
Yeah.
a night robe.
Lawrence, give me a thumbs up when you're ready. Okay.
Jackie and I negate resolve.
Wait, can you hear that? Hold on, let me fix it. Share computer audio.
United.
Okay.
Jackie and I negate resolve. The United States federal government should impose price controls on the pharmaceutical industry. Contention 1 is delays. Beryl from the London School of Economics in 2011 writes that price regulation can delay launch of new drugs because of the inevitable price negotiation between governments and companies. Furthering that introductions in price-controlled markets lag up to 2.6 years behind free price markets. Unfortunately, Spiegel from the Hill in 2017 writes that this delay can be deadly, as 600,000 European deaths could be avoided each year if healthcare offered timely medical treatments. Contention 2 is cutting off access. Sullivan of Policy and Medicine in 2018 explains that low prices eliminate the rationale for investments in better manufacturing technologies and processes, since price controls limit profit margins. This is empirically proven, as Ridley from Duke University in 2016 writes that low prices reduce the incentive to invest in quality and reliability. Indeed, manufacturing problems, which cause recalls that often halt production, are the main cause of shortages. Unfortunately, a shortage right now would be deadly, because Golan from the Telegraph in 2018 explains that antibiotic supply chains are on the brink of collapse. Price controls would push the global market over this brink, as the Access to Medicine Foundation in May found that because there are few competitors, the failure of even one manufacturer can lead the entire supply chain to collapse. The impact is creating antibiotic shortages. Herschler from Reuters in 2017 writes that antibiotic shortages have dire consequences, since doctors have to resort to suboptimal treatments that are less efficient at killing pathogens. This is critical, as Ashiru 2015 from Public Health Matters contextualizes that 37 million lives worldwide have been saved by antibiotic treatment for TB since 2000. Contention 3 is cutting R&D. Currently, the pharmaceutical industry is pouring money into developing drugs to combat rare diseases. Ian Lloyd writes for Pharma Projects that as of October 2016, more than 4,000 drugs are in development for 447 rare diseases, demonstrating increased research within areas of unmet needs such as cancer. Unfortunately, this is an extremely costly process, as Giacoto 2005 from the University of Chicago writes that it takes 16 years and costs $802 million in research and regulatory expenses to bring a drug to market. As a result, companies often price drugs so that they can recoup investment. Unfortunately, price controls will harm the development of these life-saving drugs in two ways. First is because companies will reduce spending in R&D. Weingarten from Forbes in 2017 writes that price controls make it more difficult for manufacturers to recoup the cost of capital, diminishing the incentives to innovate. Thus, Vernon 2004 from the University of North Carolina concludes that regulating prices in the U.S. could lead to a decline in R&D of up to 32.7%. Second is because venture capital investors pull out due to insufficient profit margins. East in 2018 from Stat News writes that if profitability for new drugs declined, venture capital for risky long-term biopharmaceutical investments would shrink exponentially. Unfortunately, Platzer 2006 from the NBCA continues that virtually the entire biotechnology industry would not exist without venture capital. There's historical precedent for this. Millam in 2009 writes that when the Clinton administration proposed to place caps on the price of drugs, the industry reduced R&D spending by $1.6 billion. It was not until companies were sure the plan had failed that R&D spending returned to previous levels. If price controls had been successfully implemented, Santier finds that this would have led to 198 fewer new drugs being brought to the U.S. market from 1981 to 2000. The impact is saving lives. Lloyd concludes that rare disease patients as a whole are estimated at 350 million people worldwide, and the ITIF finds that pharmaceutical innovation accounted for 73% of the increase in life expectancy worldwide. Thus, Jackie and I are proud to negate.
Okay, everyone good with that?
What do you guys think is their best contention?
My computer froze for like the last half of their speech, so.
All right, who wants to fill her in?
I'll try.
Wait, Davina, where did you stop? You are muted.
After companies would spend less money for R&D.
Okay, yeah, that was their third contention. How far did you get with that? Like they just said that?
They had just said that, yeah.
Okay, yeah. So then I think they said like thousands of drugs like have been developed and it's a very expensive process and it takes 16 years and $802 million to launch a drug. And the price controls would harm development and it would reduce spending in research and development. And then what does that word say? Oh yeah, regulating the price would cause a 32.7% decline in the number of drugs that are like produced. And then it would cause investors to pull out and it would make the venture capital shrink and the med technology industry would fall. And the caps on drugs would reduce spending by 6.2 billion, I think. And then if like that plan to put caps on the prices had gone through, then there would be 198 fewer drugs in 1988 to 2000. And then drug like development and stuff has caused like 73% of the life expectancy increase. So, yeah. That's all.
Okay, how did we feel about flowing at that pace? Better than yesterday?
Yeah, it was good. I didn't get to write down like a lot of the like specific numbers and stuff, but
I mean, you got more than I did. Like that one number, no clue what that was for research and development.
well, I didn't get really, I got like 2 for the first 2 contentions, so.
16 ways to go 2 mil.
But they probably won't go for their first key contentions anyway, right?
I would if I like that was really good. That was impressive. I would try if you can to write down some author names like Weingart. I remember was really important from this topic. He's the one who said that innovation will go down. There was the Clinton. I mean, but like that's not as important, I guess. But when you actually prep for the topic, you'll you'll have indicts to specific authors. Like we had an indict for the Weingart evidence. So whenever you hear that, write it down, then you can read it. But that doesn't matter for this. Obviously.
Thanks.
Also, one more thing on indicts. If it's like a big study that's like really big for the topic and you see like someone reading different evidence like under a different name, call for that card, Command F, like the study you know the indict for, and the paper they have is probably based on the study you know the indict for, so you can still read that indict, if that makes sense.
Wait, so it's like another author cites the original one, you mean?
Yeah. Like the indict still holds true.
And even if it isn't in there, like a lot of the time it's the same methodology or the same logic you can use.
Is everybody good? Albie and I affirm resolve. The United States federal government should impose price controls on the pharmaceutical industry. Our sole contention is correcting the market. There's a crisis in the United States revolving around the affordability of pharmaceutical drugs. Henry Waxman of the Commonwealth Fund reports in 2017 that drug prices have increased 10% annually, exceeding inflation. Court of Market Watch corroborates in 2017, finding that the price of most common medications have increased by 85%. Dana Sarnek of Johns Hopkins University Florida explains in 2017, compared to other high-income developing countries, U.S. prices are 117% higher and health outcomes are significantly worse. Pharmaceutical companies are at fault. Fox of the Harvard Business Review in 2017 reports that drug companies utilize a number of tactics to thwart competition, including bribing generic companies to keep cheap alternatives off the market, filing citizen petitions to delay generics from being federally approved, and restricting smaller business access to drug samples for testing. Big Pharma has consolidated a market with monopoly-esque tactics, effectively preventing affordable options from entering the market. Even generic drugs, supposedly more affordable, are driven off the market by Big Pharma. Large branded companies spike their prices right before generic entry to ensure high price points for both drugs. Dave of the International Medicine quantifies in 2017, an average price increase of 30% increases generic drug prices by 60% as well. Thus, Dean Baker of New York Times concludes in 2017 that the prices are hundreds of times the normal free market price. When the market fails, the government steps in to put it back on track. Price controls correct the pharmaceutical market in 2 ways. First, directly setting the price. Price control means that firms aren't allowed to set prices above a certain level, leading to lower prices for consumers. No matter how much the industry is consolidated or exploits the market, the end result must be lower prices. Empirically, this has happened in similar countries that impose price controls. Marzak of the Croatian Medical Journal in 2002 reports all EU countries have imposed pricing and saw lower prices by 25%. Thus, in the bigger market of the United States, the cost of the Cochrane Library quantifies in 2014 that price controls in the U.S. will reduce costs by 49% in just 1 year. Second is stopping consolidation. Sorcha Public Citizen magazine reports in 2016, over the past few years has seen the consolidation of the pharmaceutical industry as larger companies have captured 64% of the global market, up from 28% in 2007. Companies consolidate to increase prices. Gagnon Globalization Health Journal in 2017 reports several companies dominate the non-competitive markets by cornering niche markets through killer acquisitions so they can substantially increase prices. Price controls reverse this because they remove the reason that companies monopolize in the first place. If they cannot increase prices, they have no incentive to acquire. But additionally, it makes it inefficient to have a monopoly in the first place since they can no longer offset the high development costs with having high prices. Suit of the Rand Corporation in 2008 explains direct price controls reduce big pharma revenues by 16%. For these two reasons, Brecky of the Journal of Public Economics quantifies in 2010, under price control systems, large monopolies see a 15% reduction in brand name market shares and a drop in average prices by 30%. Correcting the market increases prescription access in two levels. First, in the United States, Waxman argues that 1/3 of Americans go without taking their prescriptions because of high costs. Fortunately, Levy of the Hebrew University Business School quantifies in 2014, setting prices 20% lower, increased number of patients using drugs by 23%. This is critical. Benjamin of the Public Health reports in 2012, there's approximately 125,000 deaths per year in the United States due to non-adherence to prescriptions. Second is in the rest of the world. Bostani of The Guardian explains that Big Pharma requires domestic governments across the world to transfer all intellectual property rights to the United States, meaning they can only buy from us. This extends the U.S. monopoly globally and prevents other countries from developing generics, which is why 1.4 billion people cannot afford the patented drugs needed to save their lives. And 75% of all global HIV patients cannot access cures because they only have patented options in their area. Because medicine should give people their life instead of a receipt, we affirm.
All right, did everyone follow that one too? Listen to Cross.
What a pro.
Okay, let's just go for it then.
Can I have the first question?
Of course.
Let's look at M&As. Is there a link that because companies have decreased revenue, they can't afford to buy other
There's
companies?
two reasons why we say we break down monopolies. One, we say the reason why they monopolize in the first place is to be able to hike up prices. If you stop them from being able to hike up prices, they have no incentive to merge.
Wait, hold on.
But
Why is that the
can
only
I finish my
incentive?
answer?
Yeah.
I have like a second reason,
Okay,
right?
yeah.
The second one is about capacity. We tell you when you decrease their revenue, they're not going to be able to pay for the mergers and acquisitions, which they want to so much. Can I ask you a question?
Yeah.
Okay. So you read in your first contention there's 600,000 deaths because of delays.
Yes.
What is the evidence actually about?
That's what the evidence is about.
The evidence says there's 600,000 deaths because of colon cancer.
No. So, like, I realize you just looked at the card and controlled at 600,000. But if you'd gone further, you'd see that the second 600,000
Right.
numbers is about price controls
so
causing delays in
they
Europe.
say there's delays and there's a drug
Yes.
that solves for colon cancer, right? Like it's good for colon cancer. But then the 600,000 deaths isn't because of the delay.
Yeah,
right?
it is.
They just say there's 600,000 deaths because of colon cancer in
The
general.
paragraph said
Okay.
delays are deadly.
All right.
They cause
The
600,000.
judges can call for that
Yeah.
evidence.
Okay.
Yeah.
Let's talk about the impact on the global impact. Like, what's the warrant behind this?
The global impact. Okay.
Yeah.
So the second impact is
Yeah.
about other countries getting their intellectual property bought out by the United States monopolies,
Well,
which
what do you mean?
means
Like, if a company in
No, like-
another country produces
like,
a
yeah.
drug,
So I'm
is
about
their
to
patent
explain.
bought by the United States?
Can I explain it?
Yeah.
Okay, so other countries want to make their own branded drugs, but the United States buys up their intellectual property, which means they can only buy from the U.S. patented drugs, which is significantly
Okay.
higher in cost, which is why 1.4 billion people
So-
cannot afford the drugs around the entire world.
So
Can I ask
the
you a
U.S.
question?
Hold on. The U.S.
Sure.
wants that patent because they want to be able to sell that drug, right?
Right.
So why would that change in an app world?
You decrease their ability to have such a strong monopoly in the
But
app
they
world.
still want to sell the drug. Like,
Okay,
that doesn't change
look,
the incentive
here's the
for buying
comparative
the
analysis
patent.
that you won't do for us. In a con world, you do nothing about the monopolies, which we say exist in the status quo. In the app world, we have a risk of breaking them down. I'm gonna
No,
ask you a
you
question.
don't, because you're not
Okay.
explaining to me the solvency.
Look, we're
Like, if the
gonna
company-
disagree on the links, but can I ask you a question?
You never answered my original question.
Okay, so you
Like,
can ask it.
if the company wants to buy a patent because they just want to sell that drug, then why does implementing a price control change that?
Okay, so if you implement a price control, you decrease their ability to form a monopoly, which is how they gain their power to buy up intellectual property.
Okay,
Can
so
I
it's that
ask
they
you a
don't have the
question?
money.
You've
Yeah.
been on this for like a minute. Okay, so you say that like in your third contention that you like create like innovation right now in the status quo, right? So like why do companies innovate?
They want to make new drugs to sell them,
Okay, why do they want to make new drugs?
so they can sell.
Okay, so they want to make money, right?
Yeah.
So why would they stop innovating?
Because they literally don't. So when you innovate, you pour billions of dollars into a product, and then you take a risk because you think, oh, I might be able to get billions of dollars of profit back. When you cut into their profit, it's no longer worth the
So,
risk to
like
innovate.
a
those new
pharmaceutical
drugs.
company like invests in R&D to make money, right? So what is like Pfizer's going to sell toiletries like just because?
Yeah, they can just sell the drugs they have right now.
Okay.
Izzy, are you flowing right now?
You're muted.
I know I'm not flowing. I was just adding the stuff that I didn't write down clearly enough.
Because big no is flowing
Right.
crossfire.
No, I wasn't flowing the crossfire. I was adding to what I wrote down already.
Yay.
We're really burning through this round.
The
Can we
31
talk about
seconds.
that?
Wow.
Well, nothing's happened. What do you want to?
Oh, a lot has happened. What do you mean? Like, what are you guys thinking so far? Like, if you were the rebuttal speaker, like, what do you think are the opponent's best arguments that you want to really like? What do you think they're going to collapse on? What do you think each team is going to collapse on? Start in the neg. Which contention is the best?
Second contention.
I think the
The first contention.
well, they have the most evidence for the third contention.
Or not necessarily contention, just which argument seems the strongest to you? Because they're second and third contention.
Capitalism shrinking, I think, is pretty strong.
What?
Same with like, yeah, it like, if you put on price controls, no one's gonna invest in R&D.
Yeah, I think that was pretty strong too.
What about on the F?
The monopolization.
That was their entire case, Lawrence.
Okay.
No, that's a solid shout though, because like monopolization is also like a good response to some of their arguments.
I'm gonna guess they probably went for like their second impact about the global thing, because that's what she spent a lot of time in Crossfire asking questions about. So probably the first round they argued about that a lot. So now she's trying to like clarify.
And she kind of butchered her questions.
Yeah, and then I'm assuming the neg probably goes for the 600,000 impact.
Wait, is it really possible to like debate the same team and then have the same arguments you did before? Like be AF twice? Like wouldn't they change that so like you'd be neg and AF one time?
I mean, you could like agree before rounds to flip the separate side. Some tournaments have side locks.
Usually you're like with your opponent, you're like, do you really want to debate the same thing again? And then you're like, no. So you just go with,
I
you
mean,
still flip for sides, but
at local tournaments, they assign sides, which kind of sucks. So you don't really have a choice. But any like smart tournament, you flip for speaker and side. But like I've debated the same team twice on the exact same day. I asked them the exact same questions in Crossfire
did you beat them?
both times. We went undefeated on the day, no big deal.
Which day was this? Was this with Ian?
This was not qualifiers yet.
Respect. Who do you think won that cross?
Not Fongster, I can tell you. Andrew was sweating.
I don't know. He ate them up on that U.S. monopoly globally. She didn't know what she was talking about, but then she ate him up on the whatever they're talking about at the end.
Her partner was having a laugh.
Her partner was having a laugh. The colon cancer, he was having none of it.
I don't know, but if you're like a second speaker or first speaker during like your other person's Crossfire, do like little facial stuff like that, and like you make the other people look so stupid. Like if your partner says something, just like shake your head, or like during their speech they say something weird, just like kind of look quizzically, and the judge will be like, "Ah, it's confusing." It's all mind games.
But don't overplay it.
Yeah,
Like you don't have to be
overdo
rude
it.
to your
Don't look
opponent.
crazy about it. But a little bit's healthy.
Like laughing at your opponent, I've done it a few times. Generally, bad practice. Like
Unless they like make a joke.
unless they make a joke. But if they're like being absolute clowns, everyone knows that there's no need to be rude.
All right. Anything else, or can I press play? I'm pressing play. Okay.
Okay. Anyone not ready? It'll just be down the app. Start off on their only contention on correcting the market. 3 turns at the top. First, the New Jersey Health Institute says that for every dollar you spend on innovative drugs,
3 turns. Jeez.
She starts off with this start on their sole contention after saying it's just going to be down their case.
Yeah.
What is this?
Okay.
you decrease healthcare expenditures by $7.20 because you reduce the incidence of hospitalizations and invasive surgeries, which are on net more expensive. We control the linkage to affordability. Second, term the contention again because it doesn't matter if drugs get more expensive or less expensive. If there's a shortage of drugs, then no one can access it. But finally, term the contention again because Mizuki explains that the most probable form of price control is reference pricing, which Trump just introduced 3 weeks ago. However, in order for reference pricing to happen, these prices in the U.S. are based on other countries' prices. So what would happen is that price companies or pharma companies would just exit markets that are price controlled. For example, when Europe implemented price controls, these pharma companies exited Bulgaria because they didn't want to sell at a low price in Bulgaria, and they didn't want that low price to influence the price of this drug in the reference price market. So at the end of the day, that causes more exits from these developing countries. So at the end of the day, that still links in. But then on the individual warrants, first on this generic spiking stuff. First, realize that even if generic prices are spiked, there's going to be more competition, which will eventually reduce the price of generics. This is because they're saying that when a company spikes the patented drug price, they can also spike the patented generic, or they can also spike the generic price. But the problem is, as more competitors enter the market, the price therefore decreases, which is why Walls finds that even though generic prices, when they first enter the market, are 60% of the patented price, they eventually decrease to 20% of the patented price, and which is why Smith finds that overall generic prices decreased by 12% in 2017. So therefore, we would say that if 90% of Americans use generics, as Forbes explains, we would solve here. But let's go to true solvencies. First, they say that we're just going to set the price. First, realize that this reduces the incentive to innovate, and it doesn't matter if the price is set if the drug doesn't actually exist. Second, if there's a shortage of drugs, it doesn't matter what price it's set at. But third, this doesn't link into their global patent stuff, so realize they can extend this warrant if they want to go for this global patent stuff. But on the second warrant on mergers, a couple of problems. First, realize that the reason why companies have monopolies is because of patents. It doesn't matter if company A has a patent or company B has a patent. There's only one patent for a drug. That's the reason why monopolies exist. But second of all, he concedes in First Cross that there's always an incentive to merge because they always want to increase the capture of market share. So even if you reduce these price gouging, as long as they want more market share, they'll still merge. But finally, the second incentive is they say that you would just decrease revenues of the companies and decrease capacity to merge. But we would just say that pharma companies just take out loans. For example, they're already in millions of dollars of debt. There's no reason why they wouldn't just take out another loan. But finally, even if you buy the M&As are going to stop in the afterward, turn the entire contention because realize that M&As are actually really good. This is because small companies that are the source of most innovation are going to be bought by larger companies. They don't have access, like small companies don't have marketing infrastructure, so they can't bring their drugs to market. But big companies are the only companies that A, can afford to do clinical trials, that's the R&D part, but B, have the marketing and research to ensure that this drug gets out on a global scale. So we would say M&As are on net pretty good. But then they say that there's a 16% revenue decrease. We realize that triggers a link into contention 2 and contention 3. On the impact level, first on the US, first realize that just because a third of Americans can't afford these drugs because they're high cost doesn't mean they all die. In fact, Ruth explains that actually insurance covers most of the cost A. So I would say that these high cost drugs probably aren't going to be very, very high cost drugs that insurance covers, but rather just going to be your average generic that people don't think are worth buying. But second of all, realize that they read this Levy card saying that when you have a 20% lower price, you're going to see a demand increase by 23%. But then the Levi card goes on to concede that if you drop prices any lower, you're going to start cutting into R&D. And insofar as the next line of the card says that most other countries with price controls have 60% lower prices, we would see that impact triggered. On the second impact on the world. First, he concedes in First Cross that this disincentive to buy a patent never changes insofar as they always want to sell drugs in developing countries, and so the disincentive never changes. It isn't incentivized on price controls. But second of all, we would say that companies in other countries don't recognize these patents. So it doesn't matter if Novartis buys a patent for this drug in India. If the Indian government doesn't recognize this patent, then they can still produce a generic. This is why India is the largest manufacturer of generics in the world. But third, there's two reasons why we would link it. First, because the World Health Organization finds that right now there are regulations allowing developing countries to produce generics of patented drugs. The only reason why the patented drug exists is because there is incentive to innovate. But second of all, because you turn the entire attention, because what MOLA explains is that high drug prices in the U.S. incentivize and allow for subsidies of donations of these drugs. But when you implement price controls, you cut donations of these drugs so that they can no longer be sent to developing countries.
Okay, we're gonna take that. Sorry.
Sina, are you flying on your computer?
No. You mean that clickety clackety?
Yeah, who's
Yeah, that's not me.
Maybe that's like the person recording. Okay, what do we think about that?
Kind of flame.
That was pretty fire. That's probably why she got third overall speaker.
It's very thorough.
I think there's a couple things she said, which if you just like know, like if you know stuff about the topic and you just kind of step out of like the debate part of it, like you know that they're not right. Like for example, she said that there's only one patent for a drug. There's always incentive. She said, okay, there's two things she said, which like there's only one patent for a drug. If you just do general research about the topic, you know that even though there's only one like patent for a specific like chemical, a lot of the time, there's often like very similar chemicals which will treat the same disease. So there's multiple patents for those different chemicals, and one company wants to buy all of those. So they're the only option when somebody wants to treat that disease, even if they don't market these other drugs. And then also she said there's always an incentive for more market share. That's not actually true if they can increase prices because they have more market share.
Wait, at the end, she was talking about like developing countries. Was her point that the high prices like allow for donations to developing countries, and then if there are like price caps, then we can't do that anymore?
Yeah, so right now pharmaceutical companies donate a lot of drugs to these developing companies because they want to like increase their reputation. They want to like sell more of these drugs. But if they don't have such a huge profit margin, they won't donate as many drugs, is the argument.
Yeah, that does make sense. And then she said that just because Americans like can't afford the drug doesn't mean they're gonna die. What was the logic there? I mean, like I know what she was trying to say, but I kind of missed the explanation for that.
Like maybe I can't afford an MRI, right? But I don't need an MRI, so that's not going to kill me.
She doesn't quantify donations also. Because she had like 5 seconds left, which is like fair. I'm not like she's really good.
She's so okay. So she didn't really signpost. I mean, she did a great job of signposting, right? Like you could pretty easily follow. She told you like exactly in the link chain, like what she was talking about, right? She ran you down like first like on the spike thing, then on to like setting direct prices. Then she just kept going. There was also a lot of turns on their case, pretty spread out. So they can't like kick anything too early because they're going to have to respond to like the 3 turns at the top, and then like I think there was 2 more turns towards the bottom.
I think their best response was, I think they should have explained this. The World Health Organization allows generics in developing countries. I don't know if that's true though.
Yeah, I didn't really follow what she was saying.
She was saying that
What's the thing? Like, what does it mean, like generic? Like, I know what the word means, but what does it mean in the drug world?
So they're like I don't know what happened to your microphone, but they're like name brand pharmaceuticals, which are like aspirin. But then there's a number of other drugs which do the same thing, but they're called like acetylphetrine, which is like it's like the same thing. After the patent expires, everyone can make it, but it doesn't have the name aspirin. And 90% of Americans, according to Forbes, use generics. They don't use the one name brand thing. Like there's a ton of allergy medicines. There's like 3 name brand things because those companies developed them, and then afterwards people were like, we're gonna make something very similar, or we're gonna wait for the patent to expire and then make our own drug, which is like the same.
Okay.
Okay, everyone. Okay, actually, I need to.
Oh, Albie. Look at the disgust on his face when he gestured to that card. The man is an actor.
He's not happy.
Okay. Is everyone ready? I'm starting on my case and going down her responses.
This guy's really good.
So everyone got the order of that? What did he say he was going to do first? What's the word for it? Lawrence? Redemption? What's it called? When he's going over his
frontlining?
Frontlining. Yes, Lawrence. 1 for 3. Okay.
Everyone good? Okay.
At the top of your case?
At the top of my case, yes. Okay. The first two turns he puts in our case are just cross applications of shortages and innovation. I'll get to that when I get to their case. But the third turn says that reference pricing will just be based on other countries and they're going to exit markets. To exit markets, they have to outsource into a new country that doesn't have price controls. All of the people who've been exiting from Bulgaria and the European Union have come to the United States. But if the United States puts price controls, there's nowhere left for them to outsource insofar as every other high-income developed country has price controls in the first place. We're not going to be seeing this exiting. But secondly, the European Union also has things like price ceiling. So this reference pricing argument doesn't make any sense. If we're going to compare them to the EU, their prices are a lot lower. We still have a link into directly setting the price. Then they read this argument about how generics, now 92% of the market is generics. But that doesn't respond to what we're saying. Generics are still incredibly unaffordable. 1/3 of Americans still cannot afford their prescription. Clearly the generic solution isn't working if for the past 20 years we've seen a steady price increase exceeding the rate of inflation. But then on our first warrant, they just try and link in and say we don't link into our second impact about global patents. If you put a price control on that, then they can't charge it at the high price that the branded companies have, which is why 1.4 billion people can have access. But then on mergers and acquisitions, they say that the patent is always going to exist, so they're always going to have the incentive. They get the patent through mergers and acquisitions. So if you reduce their intent to do that, then we sell the clear link into this. They're not going to have an incentive to merge and acquire anymore insofar as the development cost of having a monopoly is going to be A, incredibly expensive, but B, the only reason they enter a monopoly in the first place is so that they can hike prices. If you set the price, they don't want to monopolize. Then they say you can take out loans. You can take out loans for innovation too. This really just puts defense on their case as well. But then they say that small companies are good because they can be bought out, but it's a killer acquisition. It's not this symbiotic relationship. They buy up smaller companies so they can put them out of business so that they don't have competition on the market. That's why 64% of the market right now is controlled by one company. Then on the impact level, in our second impact, they say that prices are high here so they can be low in other places. That's not true either. People don't charge low prices in the developing world because they're so philanthropic. It's because they cannot make money otherwise, because a lot of the people in the developing world are impoverished. That's why the price is low there. Let's go on to their case. Their first contention talks about delays. This assumes that companies are going to outsource. This means that they're going to move away to a different market and then enter it in at the other one at a lower rate. That's not probable. There's no other place for them to go. But secondly, it doesn't take long to negotiate a price. The government says you have to charge it at 50% lower. That's not going to delay with negotiations. Their second contention talks about shortages, but there's a couple of issues here. First, they say that you're not going to have the incentive to go into the manufacturing sector. That doesn't make any sense. If you lower manufacturing costs, you'll always make more money. A price control has nothing to do with this. That's why there's not going to be a shortage. But secondly, this entire argument assumes that the price is going to be set below the supply and demand equilibrium, but they miss the Baker evidence in our case. Because of the monopolization of the industry, the price is hundreds of times the normal free market price. Then they say they're not going to have as much quality investment. If you have fewer resources, you always increase quality because now you can't have so much waste by just a large amount of quantity of goods. There isn't going to be a shortage. We're going to link to this better by deconsolidating the market in the first place because it's created by one manufacturer. Then on their third contention about research and development, they read this pharma project evidence saying that we have really good new drugs right now. That's from the pharmaceutical sector. Of course they're going to say that. Professor Light of Stanford, who explains in 2014 that 90% of all drugs that come out of the sector are Me Too drugs that have zero clinical significance because they're just creating Advil and turning it into ibuprofen and making a profit off of this. This is a really big reason to turn the argument against them, because if you have price control, the only drugs that are profitable are the ones that have a clinical benefit, the ones that cure cancer and cure Alzheimer's. So we're increasing the efficiency of innovation, which is really not going well right now. But then secondly, they say that they're going to have fewer amounts of investment into this because of venture capital investment. But the Brookings Institute explains in 2018 that venture capitalism only accounts for 3.2 million of the investment in the billion-dollar industry, which is only 2% of the entire sector. It's a really small argument in terms of the scope of it. But then they assume all of the money and the revenue is going to come out of research and development. That's not true either. They concede in First Crossfire that they're always going to have an incentive to innovate because that's what makes them money. They're going to take out of things like mergers and acquisitions because they can no longer hike prices. That's what becomes unprofitable. But then finally, you can just have the government subsidize it in the first place. The Los Angeles Times explains that 73% of all new drugs come from the government anyway. The private sector isn't that big a deal.
Should we watch Cross and then talk? Or do we want to talk now? Watch Cross.
Okay, stop. 30 seconds taken. Okay. All right. So can I have the first question?
Yeah, of course.
Okay. So why do companies buy patents in other like countries?
Like small businesses or big pharmaceutical companies?
Like why do this is specifically to your like, oh, we're extending the patent monopoly worldwide.
okay,
so why
yeah.
do they buy patents in other countries?
What, they buy patents from other countries? That's not our argument. They shut out the other market in the first place.
How do they shut out the other market?
Because A, they influence free trade deals because the monopoly has a lot of power in Congress. But secondly, and most importantly, is because they are the ones that control the market. They
Wait,
can price,
I never
it's called
heard this
price
free
gouging.
trade deal link in your case.
That was in
I
our
didn't
case.
hear deal or Congress or free trade. Anyways, you can't just
Definitely-
shift your advocacy now.
It's not shifting our advocacy. We explicitly said it in case. They influence United States trade deals. That's the industry. But more importantly is the price gouging argument, which I think we've articulated pretty well. They can fluctuate the price to make the local manufacturers go out of business because they can't produce it at that
But you're
production
not implementing
cost.
price controls in other countries, so why would that go
We're
away?
putting it on the United States, who
Yeah.
controls the market in other countries.
But
That's
you're
what
not.
we're saying.
But you're not implementing price controls on other markets. You can't just take price controls in the
United
U.S. and
States
extend it to the rest
controls
of the
their
world.
market, then putting a price
How does
control
the
on
US
them
control their
does that.
market?
That's the evidence that we indicate that reads you. It says that the patented drugs from the United States companies are responsible for having 75% of HIV patients unable to afford it, and 1.4
Yeah,
billion
but that
people
doesn't tell me
can't
anything.
afford the US.
That doesn't tell me anything. You just tell me
Why?
that people can't
Why
access
doesn't that-
HIV drugs.
Wait.
Why does this mean that patented drugs in the U.S. all of a sudden are going to extend and influence all, like, control
It's
other
happening
markets?
right now. Like,
How do they
if
control other
if it's a
markets? Can you answer
probability
this simple question? How do they
I have.
control other
First,
markets?
they influence free trade deals. Secondly, it's price gouging.
So, why would price gouging? Wait, because you can't influence prices in other
if you
countries with price.
directly set
Wait,
the price-
you can't influence prices in other countries with price controls, right?
you can influence the price that the American companies have.
Wait, but you can't influence. No, price controls only affect prices in the U.S., right?
The U.S. industry. We're putting them on the U.S. industry.
No,
we're
it
saying the
doesn't
U.S.
affect
industry
prices.
controls.
So
other
wait,
markets.
let me get this
But
straight.
We've been going
so
about
your
this for a
link,
while.
like,
It's
really quickly,
getting
it's like a
really
yes or no
muddled.
question.
It's really
a
not.
yes or no question.
Okay, sure.
So your link is that you're putting price controls on the U.S. industry, which controls the price that they set for their products.
Yes.
Yes, okay, cool,
that's what the
cool.
affirmative-
Okay, cool,
yeah. Can I
go
ask you a
for it.
question?
Yes.
So, why will companies stop producing innovation if that's the one thing that makes them money?
Because they have no choice. At the end of the day, when you implement price controls, they're literally not making money because the prices at which these products are set at are so low that they can't recoup their R&D
Why
investment.
would we set the cure for cancer like if they produce a cure for cancer, won't
Mm-hmm.
they make a lot more money than if they just produce another Me Too drug?
Here's the thing, in the status quo, in order to produce a Me Too drug, it doesn't take a lot of money to change the molecular form of the drug a little
yeah.
bit. So the vast majority of R&D spending is probably being spent on cancer drugs, right?
No, that doesn't make any
Wait,
sense.
you just told me it doesn't take a lot of money to
No,
change
no.
Me Too drugs. So therefore, the vast majority of R&D spending is probably going to cancer drugs,
If
right?
that's the case, then why are 90% of all new drugs coming out of the industry having
Right,
zero
but
clinical
all
significance?
R&D spending is focused on those 10% of drugs, right?
It's
Because you
really-
just told me that the spending doesn't
it's
go
really not.
to
The public sector is the one who's been funding the actual innovation that's been helping people because they are the ones that actually have their
So to
constituents
win
put
Me Too,
first,
you have to win government.
No, we also disincentivize Me Too drugs in the first place
Why?
because the only drugs that will be profitable in a world in
Okay,
price
yeah,
controls
actually-
are the ones that actually have a clinical benefit.
Okay.
Does everyone get the Me Too drug argument?
No, what is that?
Every time they say it, I think the Me Too movement, and I get really confused.
Yeah.
I think that's so the Me Too drug argument is basically right now it's very profitable for companies to just not to come up with drugs which are very similar to current drugs.
It's what
So a company
with aspirin.
Yeah, so a lot of companies will just come up with something that's very similar to aspirin or very similar to some common drug, and they'll make a lot of money on it. So they're pouring a lot of money into that, but it's not actually really helping people. It's just making them money because they're not curing a new disease, right? So they're saying that research and development into this kind of drug is not valuable.
Yeah, it makes sense. But wouldn't the girl, I don't know who she is, wouldn't she be right in saying that if it's easy to do that, then that still wouldn't divert a lot of money from it?
she kind of like relies on the assumption that it is like easy to do, but like she doesn't really explain why it is easy to do. And the fact that like 90% of the new drugs that are coming out are like those, like that kind of drug. I mean, I don't think it is, like, why would that be? Like, she doesn't justify why that would be easier. Like, you still have to create a new drug, create like a new molecular. Like, sure, like you have some basis for it, but that doesn't mean that like you're still not going to devote 90% of your resources to it because you're making 1,000 of these Me Too drugs and you're only focusing on one actual new drug.
So like the price controls would stop the Me Too drug? How would that work?
So basically, if you create a Me Too drug for something that's like similar, it's like worth a lot of money because like another company wants to buy that because they want to increase their market share.
Okay.
So like if I control the only aspirin and then somebody else comes out with an aspirin, I'm going to buy that. I'm going to pay them a ton of money so that I can like monopolize the market.
Yeah.
But when there's like price controls, I have a reduced incentive to try and monopolize the market, right? It doesn't matter if I'm the only person because I can't hike prices anyways, which means I have less of an incentive to pay these other companies off, which means they have a less of an incentive to create Me Too drugs.
Okay, makes sense. And so like the bad thing about the monopoly is that like you can charge whatever you want because you're the only one providing it.
What?
Like the bad thing about the monopoly would be like you can charge really expensive prices because you're the only one that has control over it.
Yeah, I think this is their best argument is that they say, did Lawrence just leave? Okay, they say that they're charging 100 per, I think that the most important thing here is the tagline for their first contention. And I don't know if they're painting like a clear enough narrative yet, but they'll probably do this in summary and final focus, where they say they're correcting the market. They're not like fixing the market. So they're saying right now, the prices for pharmaceuticals are hundreds of times more than they would be if there were like actual competition, than market rate prices, right? And that by implementing these price controls, they're not preventing these companies from becoming profitable. They're just saying, we're not going to allow you to charge hundreds of times more than you need to be profitable.
Yeah. Okay.
Okay, so let's talk about LB's rebuttal. What any thoughts right off the bat from anyone besides Sina? Davina, haven't heard from you in a while. Same with you, Cameron. Any thoughts? Or Lawrence, for that matter. No thoughts? Okay, Sina, thoughts?
I loved it. I didn't love all of it, but there were some good responses.
I thought his front lines were good. He didn't really cover his first impact, right? He only frontlined the turn.
Yeah, I mean, he was just rebuttal. Andrew will do that in some. Yeah. I think his response to the first two turns was like textbook, like it was like debating like 101. Like, this is what separates a good debater from the bad one, is that he didn't spend any time responding to them. He just said these, like, he recognized that this is just like these two first turns are a cross application of their case, and since I'm already responding to their case, I don't need to like waste time here. So he was just like, this is a cross application of shortages. I'm gonna move on because I'm addressing.
Like they responded to my case by repeating their case.
Yeah, exactly that.
Yeah, actually,
that's cross application just means they're using. Yeah, I assume you know what cross.
What were you saying?
Yeah, I don't really understand the terms the neg made. Like,
also, yeah, if there is a cross application, don't respond to it twice. Just respond to it on their case.
That takes a lot of time. Their terms. So their first one was saying that healthcare, just in general, is going to decrease under price controls.
Yeah.
And the second one said shortages don't matter if there's no access, I think.
If there's if there's shortages, prices don't matter, because like people can't access the drugs because there are no drugs, not because they can't afford them. So like there being drugs is a prerequisite to.
Wait, their point was like the shortages would happen because investors would pull out.
Yeah, because people would stop making new drugs because there's like no incentive to do it anymore, is what they're arguing. But this is a good response because this is kind of like leading up to the weighing later, is that the shortages are a prerequisite to like low prices. So that like to access, which is the same thing, I guess. So later on in the round, the neg is going to say our impact is a prerequisite to your impact. So if there aren't drugs, if there's only like 5 drugs for everyone in the company, it doesn't matter if those drugs are really cheap, because that still means that 95% of people will be going without their drugs, right? Even if they're really cheap. At that point, like existence of drugs, it just like outweighs their.
Would that be true though? Because they said that like the investors only account for 2% of
At this level of debate, it doesn't matter if it's true.
What? That doesn't make any sense.
Like, we'll talk about it later, but like when you get to a high level debate, like when it's really techy, it will be tech over truth, which means if you have cards and you extend them and you explain them, it doesn't matter if they're necessarily true, right? The judge is still going to vote because you're like in the debate realm, it makes sense because you're doing what debate is, right?
I mean, I don't know. I think that you can make the argument that it is true, because they're going to say even if it's only 2% of the even if it's only 2% of the industry, like first of all, that has ramifications throughout the industry, because it's not just venture capitalists, it's a variety of people who are investing in the industry. So other investors will pull out when venture capitalists pull out. But then second, even if it's only 2% of the industry, just like ignore that. If it's 195 fewer drugs, that's 195 fewer drugs. It doesn't matter what percentage of the industry that is. That's a lot of people who are going to die because of this. And they impact that out. But they say that 195 fewer drugs would be produced. So that's the important part. And I would say it's because other sectors respond to venture capitalists drawing out.
All right, so between the two teams we have, who wants to go neg, who wants to go af? Does anyone care?
Davina left.
Really? I mean, I think I understand the neg case a bit more. I didn't really flow the af, right? So.
Okay, Izzy, Cameron, are you guys okay with that?
Yeah.
Izzy, you might want to pop out for a second.
Yeah, how about you leave the Zoom and come back in, so we don't have to deal with your robotic voice.
Wait, what's happening?
Yeah, your voice is like going in and out really, really quickly.
So Lawrence, you're going neg?
Yeah, I'll go neg.
And neg spoke first, so.
Wait, so what are we supposed to do?
You want to give a summary and a final focus?
Where did Davina go?
Don't know. Sina, you want to give a summary?
Oh, Davina.
Could you guys explain like the af case really quickly?
Hold on. Davina, we're gonna do summary now. Are you good to like have
my internet keeps cutting out, so I'm trying to fix that right now.
Okay.
Lawrence, if your opponents do well, they should explain the case to you.
Okay. Or
Cameron, that's you, right? You're doing the summary?
Okay.
Guess so.
Yeah, Cameron, just use this time to prep. Like, we're not really timing prep, so just use as much as you want to make sure it's good. And then we'll redo it until it gets good, giving you like critique, if that makes sense. Also, Izzy might just be like waiting to get in. Someone should probably.
She's texting me right now, so we'll see what she says.
Maybe Sid has to let her in.
She said she can't get back into the PF room.
Oh.
I'll text Sid.
Or maybe I stopped